record this session as well. And then, where did this go to now? Can you see my screen?
Yeah.
It's Medical Imaging Portfolio 5201.
Mm-hmm.
Okay, so that is the Moodle book that I've put together. And then in the Moodle book itself, so what the Moodle book, when you click on it, there's a couple of subfolders. So for the medical imaging portfolio, these are the learning outcomes that's being addressed in the medical imaging portfolio. And then the main one is actually some of the resources that's there. So I'm going to go through the PowerPoint presentation with you, and hopefully some of it will make sense. So again, it's myself and Crystal, and then also all of the unit objectives that apply. For this unit, of course, you use all of the resources that you've learned through the 12 weeks, and you apply that to the portfolio. So the portfolio has a weighting of 25%, so it's quite a significant part of the unit. And the expectation is that there will be 25 cases that will be uploaded, and that should cover the body regions, and there should be both normal cases and abnormal cases. So in the 25 cases, because the CT is less, only 5 cases should be included. However, if you don't get any CT cases, then we could just focus on the plain X-ray imaging if that's needed. So with the cases that you have, so looking at the plain X-ray, that should include the cervical spine, the shoulder, upper limb, the chest, and the pelvis and the lower limb. So any of those types of cases can be uploaded. And then any images that you use when you do your case reports should be de-identified. So it should just be the case itself. There should be no names, not of the hospital or the doctor or any of that. If you do get CT cases, normally because CT's got lots of slides, normally we say a maximum of 4 single slices for a case. And then I will go through how we work out the word length for each of the cases. So there's 2 parts to the portfolio. The first part is the clinical case reports. So that is what I've talked about, the mixture of 25 cases. And then covering the range of the body areas and for the CT, and that is optional. So if you don't get CT cases, you don't need to stress. All 25 can be plain X-ray. However, if you have got problems with finding 25 cases, then we need to think of an alternative and maybe see if there's some resources that we can direct you to so that you get a range at least of some of the plain X-rays. And then when you write up the document, things that we are looking for each of the case is a description of the mechanism of injury. You should have 1 or 2 de-identified images, and then the report that the radiographers normally produce is called a preliminary image evaluation, a PIE. And through the unit, of course, you will learn how to produce the PIE. And then what you do is you then compare, say, your comments. So you write this up, and if you have got the radiologist report, and that's why I said it might be tricky for you now.
Yeah, definitely.
Compare what you think and what the radiologist said, and then say, okay, I missed this, and this is what the radiologist mentioned, you know. So it might be a little bit tricky for you, and if it's not necessary, but immediate patient management is an optional one. And then once you've done the case reports, you then do a self-auditing record. And this is where you use what we call a 2x2 table. Now, I don't know as a paramedic whether you've used the 2x2 table to work out true negative, true positive, false negative, and false positive. Have you used any of that before?
I think I have it once or twice, but it's not something I've used recently.
Okay. I've actually put under this week just some basics on statistics, which explains some of that. There is another link that I've put there where you can work through more statistics if you've got the time, but the basic statistics would also be helpful. And then in the end, you work out the sensitivity, specificity, and accuracy. Because with the self-auditing, what you want to determine is how good are you at finding that there's no abnormality, or how good are you at actually finding that there is an abnormality. Now, in terms of the PIE record, so I've this list here doesn't cover everything, it's just an example. So that you would say, for example, with say the cervical spine, and then true positive would mean that you've correctly identified an abnormality, and the radiologist agrees. Basically, when you look at the radiologist's report, it's in agreement with each other. And say, for example, if it's a true negative for the shoulder, where you correctly identify there's no abnormality, and the radiologist reports agrees with that as well. So the basic statistics go through that. And then once you have completed that, you then work out the this 2x2 table. And for example, so if you've got your 25 cases, you will then work out how many of those cases you were in agreement with the radiologist. So you would work out the number of true positive cases that you've had, and write it in that block. And then you would work out the true negative cases where you are in agreement that there's no abnormality with the radiologist. And then the tricky bit is when it comes to the false positive. And that's where you think is abnormal. However, the radiologist says it's a normal case. And then, of course, we will have the false negatives. And that is where you are saying it's normal, but it's actually an abnormal case. So that's your false negatives and your false positives. And this will then produce a table that looks like this. So you can work out how many cases you have for true positive, false negative, or false positive, and so forth. Now, when you have your comment and you compare that to the radiologist, because the expectation is not that students undertaking this unit will write everything that the radiologist is writing. The expectation is, say, for example, if the patient comes in, has an injury and query whether the neck is stable, and you see maybe there is a fracture. However, the radiologist then sees some arthritic types of issues there. That is not the main question. So when you work out true positive, it's about answering the clinical question. So if you've identified there is a fracture, and the radiologists have identified there is a fracture, but however they've added some other things which is not related to the main question, then you ignore the rest. Then your true positive will be 1, and because it is radiologist. However, say, for example, if you have a case where there's more than one pathology. So say, for example, in the wrist, you identify there's a fracture. Radiologist identifies there's a fracture. However, you miss out that there is associated dislocation as well. So it means you got half of it right. And then what you do is then you fractionate. So you would say yours is 0.5. It's half a mark instead of a full mark. So you can use fractions. And of course, what you would then do is you identified it's a true positive, but the fraction that you got wrong is because you did not identify the other one. It is then a false negative. So you've not identified that abnormality. And that is in the other PowerPoint that I've also made available. I hope that makes sense for you. You can break it further down as well as in this next slide, but you can maybe just keep it very simple. I tend to try and let the students just keep it very simple. And then once you have worked out the 2x2 table, you then add up all your true positives, true negatives, false negatives, and false positives. And then you work out the sensitivity. So the sensitivity is to identify how good you are at picking up the abnormalities. So you want to see the true positive, and there is a formula to do that. And then you work out the specificity, which indicates how good you are in excluding abnormalities, so identifying the normals. And then the accuracy is an overall accuracy rate that you work out. That then, these stats is included in your report. And then also just a brief reflection. And normally it's maybe one or two things that you add that you've picked up. It could be that you say, I'm good at picking up adult abnormalities, say for example in the elbow, but pediatric, I see that I've missed quite a bit when compared to the radiologists. Could be something like that. Or it could be that you are overcalling on normal cases, that in many of the cases you might say there's something abnormal where in fact it is a normal case. So that is basically the brief reflection that we are asking for that. So with sensitivity, where you will identify most of the abnormal cases. So the aim is to try and be as close as you can to 100%, so that you have very few false negatives. And then with specificity, where you need to identify the normal cases, again, the aim is again to be as close as possible to 100%. Because you are not in the position, for example, where you would give an opinion where they will act on your opinion. What we do find with radiographers working on their own, quite often the referring doctors or the referring nurse will act on the radiographer's opinion, although they still need to get the final report. And so if you say something is, if you have a high risk of false positives, for example, if you say a patient was in an accident and you say there could be something wrong with the cervical spine, the patient is then sent to a big hospital or the patient is referred to CT. So there's unnecessary treatment if you have a low specificity rate. I'm looking to see, and then the accuracy is the next one that you work out. And it's basically the ratio of your true positive plus your true negatives over the number of patients. So it gives you an overall accuracy rate. But normally in journal articles, you will see they would rather report just on the specificity and the accuracy rate, and the sensitivity rate. So the main thing for the clinical portfolio is to be able to collect a range of cases. And when you collect cases, that they should be normal as well as abnormal cases. And then that there should be a good spread amongst the body regions that we are actually covering. So just close that one. So that is the resources that's available.